Association between baseline psychological attributes and mental health outcomes after soldiers return from deployment. The U.S. Department of Defense, or DoD for short, is the largest employer in the world with over 3.2 million employees. While its workforce is typically younger and in better physical health than most, it is hardly immune to effects of psychological health disorders. In fact, the DoD's mission likely exacerbates the prevalence of psychological health problems. This is because service members regularly face significant stressors, such as combat trauma and extended separation from family members. Psychological health is vital for effective employees, especially in stressful occupations like military and public safety sectors. Yet little empirical work has been made to link between requisite psychological resources and important mental health outcomes across time in those sectors. This study then explores the association between baseline psychological health attributes and mental health outcomes following exposure to combat deployment. The researchers conducted a retrospective analysis of all U.S. Army soldiers who enlisted between 2009 and 2012 and took the global assessment tools before their first deployment. They analyzed whether a soldier screened positive for depression and post-traumatic stress disorder, or PTSD, after returning from deployment using logistic regressions. The researchers found that soldiers who experienced significant combat exposure were substantially more likely to screen positive for depression and PTSD once they returned home. This is especially the case if they were wounded or perceived to have been in grave danger. Soldiers with the worst pre-military psychological health attribute scores carried much higher odds of screening positive for depression and PTSD after returning home than did the top 95%. Those soldiers who scored worse might be more susceptible to developing debilitating mental health disorders when they are later exposed to combat environments. Soldiers who scored high on psychological strength measures prior to being deployed are less likely to develop mental health problems post-deployment. These findings suggest that ex-ante psychological screening can provide a meaningful way to select a workforce that is more suited for stressful environments. It can also help identify individuals at risk of developing these psychological health disorders. In addition, this can be the basis of tailored training interventions to increase their psychological health states prior to exposing them to combat. Mental health issues among working individuals are both widespread and potentially a very serious threat to organizational functioning. The current study suggests that the set of psychological attributes examined here can serve as valuable predictors of these types of issues. Also, organizations operating in a high-fidelity context could and should incorporate such factors into both their screening and training programs. More importantly, this study touches on ethical considerations for recruiting employees into jobs that carry significant risk and possible exposure to trauma. Doing so carries a triple threat risk to the individual, organization, and society that, if realized, cannot be undone. For such jobs, early identification of high-risk workers needs to be coupled with adequate psychological and social resources. This is to help such workers with better coping skills when dealing with stressors of their workplaces.